Good morning everyone, this is Dr. Smita Vats welcoming you all to a brief advisory on traveling in pregnancy, and today we will be discussing small travel tips which may help you while you are planning a long distance journey in pregnancy. So one of the important questions which is on the minds of a couple who is pregnant is whether or not they should be traveling in pregnancy. Well, my advice to these people is that it is okay to travel within the city for work purposes or for going to office, unless and until of course your doctor has advised you to take bed rest for certain medical reasons. But any kind of long distance travel outside the city or at a far off location should be avoided in the first or the last 3 months of pregnancy. This is because at the first 3 months there is more incidence of nausea, vomiting, gastritis, feeling uncomfortable because of the pregnancy hormones, and the risk of abortion is much higher in the first 3 months. And in the last 3 months again, the women feel more uncomfortable because of the increasing bulk of pregnancy, and there is more of backache, body ache, more incidence of premature labor, or sometimes some people are at a high risk of developing leaking or something. So all these complications are more in the last 3 months. So relatively the middle 3 months, that is between the 14th to 27th week of pregnancy, is much safer to plan a long distance travel. And whenever you are traveling, you should maintain adequate hydration during the journey. So carry your own drinking water, or if at all you find drinking plain water uncomfortable, you can maybe add a dash of lime or mint to it, or drink coconut water or juices or whatever suits you. But do maintain adequate liquid intake, and also take frequent small meals while you are traveling. Do not buy uncovered or uncooked food from roadside vendors or stalls outside. And if at all you have to depend on outside stalls or restaurants, etc., for any food, just make sure that the place is hygienic and clean, and it is always preferable to buy packed food stuff rather than going for open stuff. And whenever you're traveling, avoid lifting very heavy weights or your baggage or something. Just make sure that somebody is around who can carry your baggage for you, and you should not be unnecessarily exerting yourself. Do make sure that the place where you're traveling and on the route also, there are adequate healthcare facilities in close access, and do make a point of noting down the important emergency contact numbers and whatever people you would want to contact in case of an emergency even while you're traveling. So whatever location you're planning to go, just find out if there are any nearby hospitals or doctors whom you can visit in case of an emergency. And it is absolutely essential to carry your necessary medications that you're taking in pregnancy, as well as all your documents. If not the originals, at least carry the photocopies of the documents of all the investigation reports, the ultrasounds, the doctor's prescriptions, etc. This is because if at all you need to visit a doctor in emergency at your holiday spot, it is always better if the doctor knows what your previous medical history has been like, what the status of the pregnancy is, and it helps them to make a proper treatment. So coming to the individual modes of travel, whenever you are traveling by road, it is always preferable to take your own vehicle for the trip. This is so because you will be more likely to be able to take due precautions while you are traveling by your own vehicle, and you will be able to take frequent stops in order to stretch your limbs and to rest a while whenever you want to, if you are traveling by your own vehicle. This becomes more difficult while using a public vehicle. And even while traveling by a car, whether you are driving yourself or you're in the front seat or in the back seat, wherever, it is always preferable to tie your seat belt. That is a 3-point seat belt which passes in between, from one shoulder to between your breast to the other side, and the lower strap of the belt should be passing below your belly over your thighs to the first side again. And many people ask whether or not it is advisable to keep the airbags on when you're traveling by road in your car. So yes, it is absolutely safe to keep the airbags on, and it is in fact recommended to keep them on an on status, because it prevents any kind of direct impact or injury on the abdomen and the uterus if at all there is a mishap or an accident. But do make sure that there is a space of at least 1 foot between your abdomen and the airbag before it is inflated. Then avoid any non-stop travel for over 4 to 5 hours whenever you're traveling by road also. So take frequent stops, and do not go to very far off places that involve long road journeys. Follow the basic general precautions that we discussed in the previous slide about the general tips on traveling during pregnancy, and take due care. Drinking lots of liquids is definitely advisable, but avoid drinks that contain excess of caffeine or alcohol. This of course holds true for throughout the pregnancy, not just while traveling. Well, as far as train travel is concerned, this is considered quite safe in pregnancy, but it is important to remember to keep moving your legs while you are traveling by train also. So whenever possible, just get up and maybe walk around a little bit, or even while you are sitting, just keep folding your knees and straightening your legs. Maybe you can twist your ankles round and round, and just fold them, flex them and straighten them, and do a little bit of leg exercises, limb exercises, breathing exercises while you are traveling. And again, even in the train, it is important to carry your own safe drinking water, and preferably your own food packets, so that you don't have to resort to the outside food stuff while you are traveling, so which can increase the chances of infection, and which would unnecessarily make you take antibiotics and other medications during pregnancy, which are best avoided if at all you can. And whenever you're walking within the train, just make sure that you're holding the side rails and the seats or whatever is available for support. Don't just walk without any support, because sometimes the trains do have a tendency of jerking suddenly, and which may increase your possibility of falling down. So just take care when you're traveling by train about that. And it is also important to ask for lower berths when you're traveling. So because it may be difficult to climb on the upper berths while you're traveling by a train, and getting up and down the berths may be difficult during pregnancy. So preferably request for lower berths while traveling by train. Well, traveling by air is also considered to be alright and safe in pregnancy, but of course all the airlines have their own set of rules and regulations regarding allowing pregnant women to travel. But most of the airlines do allow travel in pregnancy till maybe 36 to 37 weeks. In India, the Air India allows traveling in pregnancy between 32 to up to 32 to 35 weeks, depending upon what your condition is like. Of course, you would need a certification by your doctor that you are fit to travel, and of course, you should be visiting your doctor before planning any long distance travel in pregnancy, be it by road, by ship, or by train, or aeroplane, or whatever. So while flying in an airplane, avoid altitudes above 7,000 feet, and you should always wear your seatbelt even while you're traveling, even while the seatbelt sign is off on the panel. This is because unexpected turbulence can happen at any point of time, and if it is a very long distance journey, you should be wearing elastic stockings, which in order to reduce your chances of developing blood clots in the legs and the chances of developing deep vein thrombosis, which can lead to serious complications in pregnancy. So even while you're sitting on the seat, keep exercising your legs and the limbs, just as you would do in a train travel also. And avoid traveling after 32 to 37 weeks, because the risk of premature delivery or other complications may increase after that. And follow the general rules that have been discussed before, and your air travel should be relatively safe. Well, sea travel increases the risk of seasickness, the nausea and the vomiting in pregnancy. So just carry your necessary medications after consulting your doctor, and just follow the general precautions that are advised to be taken during pregnancy. And although it is not possible all the time to have access to a proper planned healthcare facility while you're traveling by ship, but do make sure that there is a doctor or a proper medical personnel available on the ship who can take care of you in case of an emergency. So by and large, if you plan a travel during pregnancy within the second trimester and follow the general precautions, maintain hydration, and take due precautions in food and dietary habits, your travel should be pleasant and should be uneventful. This is Dr. Smita Vats from Mom Plus. Thank you for your attention.